we'll spray some saccharin or sugar, and if you can taste it, the mask is not working. Yeah, so they put a little tent over your head. Huh?
Oh my God.
It may. Put on bouffant.
Do all the exercise.
Okay. All right, so tuberculosis is caused by spore-forming bacteria. It is both droplet and airborne. Most common in lungs, but can affect other areas. Increase in incidence in the U.S. due to increased immigrant population, also HIV, contribute to the rise in TB. It is highly communicable, which means that it is, if you have it, you can easily give it to somebody else, very easily. Okay. Usually no apparent sign or symptoms. The early stages includes fatigue, loss of appetite, weight loss, fever, and also night sweats. Are you guys familiar with this type of symptoms? When was the last time you guys went to a medical office or a clinic to get a checkup? There's going to be a series of questions. The first set of questions are, have you noticed any fatigue, loss of appetite, weight loss, fever, night sweats? That's always on the very front page of the forms that they fill out. Why? Because they want to know if you have TB. Okay, they're not telling you, but that's what it's for. They want to know if you have TB, and if they do, they're going to isolate you in another room. I'm just kidding. You know, whisk you away. Okay. Later stages includes cough, hemoptysis. What's hemoptysis?
Coughing up blood.
Okay, wheezing, rales. Rales is kind of like a crackly sound, like you're crunching on Lay's potato chip bags. Yeah, that's rales. Tracheal deviation. Sounds like a whistle or a kazoo as air is going through your windpipes, and also chest pain. Can be dormant and reappear when individuals' health becomes compromised. All right. So you may know somebody who has TB. They're not appearing with the symptoms. They're simply carriers. Okay. So TB in its early stages is treatable. If left untreated, lung tissue is destroyed, leading to respiratory failure. Just coughing. You have TB?
Yes. Yeah. That's why I'm here.
All right, fine. All right, and then I have a list of all the different types of antimicrobial type of resistant isolation diseases up in here. You guys, so you guys should already be familiar with this. MRSA, Versa, Ver. Have you guys ever heard of CRE? CRE is another one. So what happened?
Do we all know these?
Yes. Carbapenem. Carbapenem is a very strong antibiotic, and you can be resistant to that. Bacteremia and also fungemia is basically sepsis of your blood. It can lead to septic shock. We talked about that last week, right?
Yes.
So what these things do is that they release different types of endotoxins in your vascular system, causing your vessels to vasodilate. Remember, they have to be tight to push blood back. If they dilate, blood pools. Doesn't get returned back to your heart, and that's the cause of shock. So that can lead to shock. C. diff. You guys ever hear of C. diff? Oh man, and where's C. diff usually found?
It's very in the ER.
No, I mean we're in the patient's body. Usually around their stool. Yeah. So if you don't be messing down there. No, because I mean, listen, guys. Sometimes you have to go in there and do a portal abdomen, and you're leaning up on that patient trying to get that cassette underneath them, right? You know what I'm saying? So yeah. So be careful as you're leaning. You should be wearing some kind of gown or barrier between that patient and your body in dealing with these different things, because a lot of these are contact isolation. ESBL, extended spectrum beta lactamase. ESBL for short is a type of enzyme that bacteria produce, which causes resistance to different types of antibiotics. So these are all the different things that you may see. They're either skin or respiratory or intestinal type of infections. All right, so isolation precautions then are mandated by various governmental agencies such as OSHA, to help prevent, control the spread of pathogens that cause disease, prevent the perpetuation of the cycle of infection, and also prevent the disease from patient to staff or from patient to patient. Is it really 6 o'clock?
Yes.
I know, right? Okay. I'm almost done. Hang on. Okay. Hang tight. Okay. 2005, the Center of Disease Control and Prevention, the CDC, revised and established a 2-tier system. This is just review because you guys should know this by now. The 2-tier system. Tier 1, standard precaution. What does that apply to? Wash your hands, but what else? PPE, personal protective equipment. Tier 2, what does that refer to?
The patient.
No, that's back to 1. Okay, Tier 2 refers to how your patient is isolated from the rest of the public. That's your isolation. This is where your isolation rooms come in. Okay, so one is your protection, the other one is isolation precautions. Okay, so Tier 1, PPE. Got it? Tier 2, isolation. How do you isolate that patient from the rest of the public to protect other patients and also personnel in your environment? This is Tier 2. Got it?
Yep.
Okay. Airborne isolation. I need you guys to be familiar with the different types of airborne isolation. Yes, you need to know this, okay? So airborne isolation includes SARS, bless you, smallpox, chickenpox, rubiola. What's rubiola? The measles, okay, anthrax, and also tuberculosis. Hey, do you guys notice there's chickenpox up here? Why is it not contact or direct contact?
Because it's airborne.
Scratch it, the skin starts to float in the air, you can breathe it, and yes, you're breathing it, you're tasting it.
Sucking on some chicken pox.
Okay, so it can also be airborne. Okay, so be familiar with airborne isolation. So in airborne isolation, the patient can be housed in a private room with negative pressure. Do you guys know what a negative pressure is? Open up the door and you hear this vacuum just sucking the air into the room. It's not blowing out, it's getting sucked in. That's negative pressure because we don't want anything blowing out. Negative pressure, reverse pressure. So negative pressure with a TB mask. Okay, you want to wear that thick mask. Shut the door and also practice standard precautions. So how do we know again what and what not to wear? Should be on the door, right?
Mm-hmm.
It'll tell you exactly what to wear. Droplet isolation. Contamination where the individual coughs, sneezes, or talks. Be familiar with the 3 feet safe zone. This includes influenza, the mumps, the whooping cough, pneumonia, private room or shared with individual having the same infection. So you can't place an individual with the same type of disease in the same room. Room may be left open because we're talking about droplets, and mask if within 3 feet. Contact isolation. You guys know the difference between direct and indirect, right? Direct, person to person, with the exception of what? Needle stick. Indirect is person to object to person. What's the contaminated object called?
Fomite.
Fomite, okay? So they can be placed in private or shared room with individuals having the same infection. Blood before entering, remove before leaving. Gowns are used, careful handling of dressing, and other contaminated material standard precautions. All right, lastly, this you guys have probably already had experience with is expanded isolation. Expanded isolation, also known as strict isolation. When you see that, it just means put everything on. Put everything on, okay? And there are 2 different categories. One would be to protect yourself when the sick patient is full-blown everything. Direct, indirect, airborne, droplet. Okay, they have everything. So this is when you are trying to protect yourself from the infected individual. The other one is where we're trying to protect the patient from you. Okay, you're also going to put on everything, but now we're protecting the patient because of their compromised immunity. This can be through a heart transplant, kidney transplant, someone who has full body burns, cancer, okay? Someone whose immunity is highly compromised. So now we're going to protect them. So you, again, standard precautions, but these are some of the nuances, including dedicated stethoscopes and blood pressure cuffs, as well as thermometers. You see doctors and nursing using blood pressure cuffs and stethoscopes from one patient to the next. You can't do that with these type of patients. So they have their own equipment in the rooms. No flowers, plants, fresh fruits, or vegetables. Remember the vectors? Okay, remember also microorganisms like to live in warm, moist, dark places, the soil. So vectors, also in the environment which is conducive to those microorganisms, we keep them out. No sick visitors and staff, and also this is known, this one here in particular is known as reverse isolation, because we are reversing the protection, okay? Are we done?
Yes.
All right, guys, so we have test next week. Test next week, lecture next week. What about 247? Position. What do we need?
We have a test.
We have a test. All right, good.
Oh my.
Do we have lecture 2?
Yeah,
Urinary tract. Okay.
What's the test on for position?
the whole digestive system.
Ah.
Everything.
I haven't looked at it. I have my highlighter.